Current Medicare reimbursement rates don't match real-world medical costs or inflation, jeopardizing patient care and threatening to decimate the already dwindling supply of physicians in the United States, including dermatologists. The Patients First Act is a bipartisan legislative proposal that aims to reform Medicare physician payments by tying reimbursement rates to inflation, and dermatologists are rallying behind this act and pushing for its passage. In this special advocacy episode of the Beyond the Headlines podcast, Dr. Sandra Johnson, a dermatologist in private practice in Fort Smith, Arkansas, and a member of the American Academy of Dermatology's Board of Directors, talks to Dr. Alexandra Gross, a dermatologist in Cumming, Georgia, and the chairman of the SkinPAC Board of Advisors, about the crisis facing dermatologists and how the specialty can fight back and best advocate for their patients and their profession. Take it away, Dr. Johnson.
I am honored to be here, or as I like to start everything, it is a skin-tastic day. And my name is Dr. Sandy Johnson. I am a board-certified dermatologist in Fort Smith, Arkansas, and I have the distinct pleasure of serving as this year's chair of the Grassroots Advocacy Task Force for the American Academy of Dermatology Association, as well as serve on the board of directors for the American Academy of Dermatology and American Academy of Dermatology Association. One of my board member friends, peers, colleagues, acquaintances who I've known for many, many years and who I respect greatly is Alex Gross, a dermatologist from Georgia who is the king of advocacy. He serves as the current chair of SkinPAC, as well as serves on the American Academy of Dermatology's Board of Directors, in addition to many other hats he wears. Alex, would you mind to introduce yourself? And before you do so, thank you so much for taking time out of your very busy schedule to chat with us today.
So thank you, Sandy, and I'm happy to be here. I appreciate that wonderful introduction and all those accolades. I'm not sure that I deserve all of them, but anyway, I am a dermatologist. I'm a board-certified dermatologist. I practice outside of Atlanta, Georgia. I've been involved in advocacy, both in my state of Georgia, in my state derm society, and with the American Academy of Dermatology for over 20 years. Quick story, how did I get involved in advocacy? A terrible, horrible, no good, very bad laser law was about to be passed in Georgia, which essentially would have allowed anybody, regardless of whether or not they had any medical background or training, to get a laser license from the medical board. And before that law was passed, I was asked to join the medical board to be part of that, and our state dermatology society was actually able to pass a much better law, which is the law that we have presently now. I also come by this a little bit honestly. My wife is a retired lobbyist. She was the lobbyist for Home Depot Corporation for many years. So she was able to teach me kind of sort of the rules of the road of lobbying when I very, very first got started. And I've served on the Georgia Composite Medical Board for the last 18 years as well. And that's given me the opportunity to be involved in rules making and in the legislative process in Georgia. In the AAD, I've served on both the State Policy Committee and the Congressional Policy Committee, as well as now being the chairman of SkinPAC. So I've been very, very involved in advocacy from both the state and federal sides of things for many years.
Again, thank you for all of that service. I think you are a prime example. If you want to think about dinner, either you're going to have a seat at the table or you're going to be on the menu or on the plate. And so thank you so much for being at the table and all that you do. Dermatology is forever indebted and grateful to you. One of the things that I'd like to start off speaking about and would like your opinion is this is a crucial time. This is a really scary time. What do you think is most important for dermatologists to be aware of at this time? I know there's so many pressing things right now, but what would you say your top concerns are at this time?
Well, the American Academy of Dermatology is certainly aware, and I think that all of our members are aware that what's happened over the last 20 years or so is that the cost of running a practice has gone up remarkably due to inflation, but unfortunately, reimbursements have not kept pace. So, I think that at this point, we're kind of sort of at a 20 or so percent deficit than where we were 20 years ago with regards to looking at reimbursements versus, the cost of keeping our offices open due to inflation. And I think that, what the net effect of this has been there's been a tremendous amount of consolidation of practices. So you see dermatologists who are afraid to practice on their own, and a lot of practices are being sold to private equity and venture capital companies. People are going to work for hospitals because they can't cut it on their own. They can't run their own practices. In the old days, dermatology was one of the specialties where most of us were practicing in solo practices, or at least in private practices, those of us who weren't working in academics. But unfortunately, that's eroded because financially it's become impossible for people to maintain, practices on their own.
I know, it's so scary. I graduated medical school in 1996. Do you know that I calculated it? I would have been, let's say 99213 would have been worth $100 in 1996. In 2026, not counting for inflation, just the actual amount paid, it would be $97. So I would be getting reimbursed less than I was in 1996, even though the cost of running a practice is so much greater. I think what's scaring to a lot of dermatologists, there's many things, but the proposed information that we're getting is that next year we're going to have maybe a 9% cut for dermatologists. So that $97 that I would have gotten is going to be 9% less next year. I mean, that's alarming. Don't you agree?
Yeah, and actually, when you think about a 9% cut, that really translates to 20% less that you would actually be earning because, so let's say you normally get reimbursed $100 for something.
Mm-hmm.
Your overhead is 50% of that. So really what you're getting from that $100 is maybe $40. So now your $100 is being cut to $90, and your overhead is 50%.
Increased. Yes.
Yeah. So really that 10% means more than 10% from a standpoint of earning potential. And it is really scary because things are difficult right now, and I think that a lot of practices are not going to be able to absorb another 10% cut.
Mm-hmm. I think we're blessed that one of our own dermatologists is actually a legislator, and he realizes the issues that we have. And he is one of the people that has put together a bill to put patients first and actually retie reimbursement back to inflation in the MEI. Would you mind to explain that a little bit better?
Yeah. So Representative John Joyce, who's a dermatologist from Pennsylvania, has just dropped the Patients First Act. And essentially, this does two very, very important things. Number one, it curtails net neutrality. So basically, what that means is that Congress doesn't have to rob Peter to pay Paul when it comes to reimbursing physicians with regard to Medicare. And then the other thing it does, as you mentioned, is that it increases reimbursement by MEI. MEI is the Medicare Economic Index, minus 1%. Now, the reason why it's MEI minus 1 and not just straight MEI is that when they end up scoring this bill, the CBO, the Congressional Budget Office, if they scored it based on a straight MEI, that they would never let this happen. So the MEI minus 1 actually gives us an opportunity to get an increase in reimbursement. And in this bill, that would happen for the next 10 years. And then certainly it would give us an opportunity later to get the full MEI increase each year. Hospitals get an automatic increase every year based on inflation baked in. Nursing homes get an automatic increase based on inflation every year, but physicians don't. And, it really is unfair and makes our life difficult. So this bill, which would increase reimbursement by MEI-1 for the next 10 years, would just be a godsend for dermatology and the entire house of medicine.
Yes, I think that ties back in. Right now, our reimbursements are not tied to inflation. They're just, based on something else. And so tying it to inflation is going to help all of us. So it's really important that we support Representative John Joyce and contact our legislators to get them to get on board on this and help support this bill and pass it. How do you think the best way? You've been so successful in the past and you've taught me so much. What would you encourage any dermatologist or any person listening to this, to us discussing? What would you ask them to do?
So, believe it or not, your members of Congress are also referred to as representatives. The reason why they're referred to as representatives is that their job is to represent their constituents. And all of us are constituents. And my experience has been that members of Congress are interested in hearing from their constituents, and they want to hear from their constituents. And over time, if you attend events and go to town halls and reach out to representatives, you can establish relationships with them over time. And then, they know who you are. And when you want to ask them for something, or you want to tell them what your opinion is about something, they will listen to you, especially if they have a relationship with you. Going back, 20 years, I've had a personal relationship with either the representative that represented where I live, or where my office is, or sometimes both. And I've had relationships with every one of those people. So, and now, we're talking about, 4 different people at this point, starting with Tom Price, and, currently with Rich McCormick, who represents the district where my office is.
My brother-in-law is a representative in the state of Arkansas. And so he's given me a lot of good information and ways to get around this. And I also think about, I love Stephen Covey in the 7 Habits of Highly Effective People. And one of the phrases that I think about a lot is the emotional bank account. So you have to put in 8 deposits for every 1 withdrawal. And so if we're asking our legislator or our representative to support us, we need to make sure we're giving them 8 deposits. They need to know what we want. If we only go and ask for stuff and we never give, it's not a good relationship. So as you're saying, it takes years to build these relationships. I have a great relationship with our representative, Steve Womack. Does he always support healthcare bills? No. But is he always supportive and helpful in general and tries to do what's best? Yes. And so we are co-hosting an event for him coming up in a couple of weeks. And you bet for sure I'm going to be talking to Steve and asking him to support us in the patients first, because this act is not saying it's pay your doctors more. It's saying you need to put patients first. You need to make sure that we can save our healthcare system and do the things that we need to do so that we continue to have doctors that can practice independently and do the right thing. And so I encourage everybody, just as you said, is develop those relationships, open your pocketbook, do what you can, attend fundraisers, attend events, let them know who you are, say thank you. And don't just ask for things, but show your gratitude and appreciation. They're giving up a lot of their time to represent us, and we need to make sure that we work as partners and not adversaries, in my opinion. One of the other hats you wear, did you want to say anything else to that effect, Alex?
No, but I was just going to chime in that I really love your analogy about the emotional piggy bank, and I think that's spot on and 100% correct.
Thank you. Thank you. Do you have any stories that you would like to share? Because I think when we talk to our representatives, one of the things that really resonates are patient stories. Older people like to vote, and Medicare, most old people have Medicare. And so I think our representatives will want to know stories about patients that actually suffered from the current situation. So like I am in Fort Smith, Arkansas, and we have just lost a lot of doctors, and one of our big hospital systems is closing. And our representatives need to know that we're going to lose more physicians here and our healthcare system is going to be even more distressed. We need to do whatever we can to support. And one of the best ways, when I see Steve, is going to talk about your need to put patients first. Patients need doctors. There are not going to be doctors in our community. They're going to retire. They're going to leave. They're not going to, they're going to go concierge medicine, something. Their patients with Medicare are not going to be able to have a primary care physician, a dermatologist, anyone, unless we can do something to save our healthcare system and protect Medicare so that patients have access.
Well, there are certainly lots of medical deserts around the country and certainly around the state. You can do heat maps that show where dermatologists are, and in Georgia, for instance, where I live, there's a huge number of areas, number of counties where there's no dermatologists, and in order to get to a dermatologist, you'd have to drive potentially 50 or 100 miles, and if you've got skin cancer and you can't get to somebody, and that skin cancer just gets larger and larger, to the point where you get to see somebody, and what could have been an easy surgery turns out to be something that's very, very complicated. And I can tell you that I've seen that many times. And my colleagues who live in more rural areas tend to see more of these cases where patients have been neglected, just basically because they live in one of these deserts.
Right. I bet every person listening to us and tuning in has 1 to 3 stories they can think off the top of their head where a patient has suffered due to the state of our healthcare system and access to care. I hope that anybody listening would reach out to their representatives or reach out to us at the American Academy of Dermatology or reach out to Alex or me or somewhere, share your story and let our representatives know that we need to save our healthcare system. We need them to support this patient first bill. Another way you can support is by following one of the other hats Alex wears and is donating to SkinPAC. And so if you don't have those relationships and you want to do something, my husband and I are both dermatologists. And ever since SkinPAC started, we each donate $5,000 per year. So the two of us donate $10,000 per year and have for a long time, probably 20 plus years. We consider it one of our insurance plans, and it has the best return on investment. We hope to never need our insurance, but we always know that our contributions to SkinPAC will make a good return on our investment. Alex, you've been chair of SkinPAC now for a while. Would you share some of the reasons why people should support SkinPAC and some of the wins that we've had?
I think that, going way back, that for the longest time we had this issue with what was called the SGR, the sustainable growth rate.
Mm-hmm.
And what happened was, and this is going back now 15 years, that every year what would happen is that we were faced with the threat of having a 20% cut because we were not getting a sustained growth, that Congress would have to go and give us
a Band-Aid. They would give us a Band-Aid, essentially.
Exactly. It was a Band-Aid, and every 6 months they would have to vote on maintaining the status quo with regard to reimbursement. And, finally, we were able to get a bill passed that did away with the sustainable growth rate so that we had at least a stable, for a time, reimbursement. We didn't have to worry about being cut by 20%. And the unfortunate thing that happened was that bill really was only helpful for the first couple of years. So after, we had the sustainable growth rate repealed and we got a couple of years of small increases, then the increases stopped because we weren't getting the annual increases like the hospitals and the nursing homes. And Congress actually started cutting our reimbursement. So, we would get a 2% or a 3% cut every year, and the reimbursement started to go down. But at that time, the repeal of the SGR was felt to be a big win. And now, I kind of sort of feel like we've gone back in time We're right, back where we started trying to get a reasonable reimbursement rate, because we're back at that same 20%.
We need to tie our reimbursement to inflation.
Absolutely.
And that needs to happen. And so we want the Patient First Act to be passed. I guess I'm going to ask, I'm going to be needy. I haven't deposited much into the emotional bank account of anybody listening, but I'm going to ask for help. I'm going to ask anybody listening to please reach out to the representative and talk to them about this bill, share your story with them. I'm going to ask you, if you can, to donate whatever you can to SkinPAC. It's, I think the website is skinpac.org. Is that correct, Alex?
Yeah, so if you want to donate to SkinPAC, you can text SkinPAC to 71777, or you can go to www.skinpac.org. And let me just say a few words about SkinPAC. SkinPAC is now the second largest medical PAC. Only the anesthesiologists have a
Oh, come on. Anybody listening, I'm competitive. Let us win. I want to be first.
We should win.
Join
Now,
your
the
friends.
thing about
Join
the
your
anesthesiologists is that there are twice as many of them as there are of us.
I don't care. I'm still competitive.
But we're just below them from a standpoint of fundraising.
Mhm.
SkinPAC is a nonpartisan, bipartisan political action committee, and really it's the American Academy of Dermatology's voice on Capitol Hill. So the money that we raise from our members' donation, we use that. We donate them to legislators. We donate them to candidates who are aligned with our advocacy priority. And it really gives us a foot in the door when we want to reach out to Congress.
I like to say SkinPAC is purple. It's not blue or red. It's choosing the color that's best for dermatologists.
It absolutely is. And really the only issue that we have, the only thing that determines who we donate to is their alignment with our advocacy priorities. That's it's our one and only metric for determining who we donate to. So I think that AAD members can feel good about donating to SkinPAC because it is indeed an investment.
Great.
We all need to be engaged, and we all need to be involved, and we all need to be invested.
Yes. So I would say, three asks. One, contact your legislator to support Patients First. Two, donate your money to SkinPAC. And three, if you want to learn more, reach out to Alex or me. Our emails, our contact information is on the AAD website. Or also, we're going to be at the legislative conference in September. If you want to learn more how you can be more active in advocacy, if you want to learn more about what's happening, if you just want to have a seat at the table and you don't know how, please join us at the legislative conference in September. It is my favorite Derm meeting of the year. It is so much fun.
It's my favorite Derm meeting too. And
yes.
I'll tell you that if you really want to be able to partake of the American experience, the fact that you as a private citizen have the opportunity to go to Washington, D.C., and meet with legislators in their offices is an experience like nothing else. It's my favorite conference too. We have great speakers.
Yes.
And it's just fantastic. And it's an amazing opportunity.
And the time we're going to be there in September is going to be when CMS needs all of the responses. So it is a pivotal time that we're going to be in Washington. And this is the last year I get to lead the legislative conference.
And you've done an amazing job, by the way.
Oh, you're kind. You're kind. But join us. Alex, thank you so much for taking time out of your schedule and chatting with us. This is so important to my heart. Any last words from you?
Stay engaged. Stay involved.
Stay skintastic.
Stay skintastic. Yeah, I want all of our AAD members to know that the AAD leadership and the board of directors is laser focused on this right now.
Yes.
I've been a member of the AAD for, 35 years now, and I've never seen such an amazing groundswell of energy and engagement. as I have with this particular issue, because it's an existential, important threat to us if we don't get this done, and I think that we're going to.
Thank you. I'm optimistic. Thank you. Have a great day.
Listeners, you have your marching orders. Thanks for tuning in to this special advocacy episode of the Beyond the Headlines podcast.